When we hear the word narcissist, we tend to picture a loud, arrogant man demanding the spotlight. But clinical psychology paints a different picture. Sometimes the person demanding total control of a room is quietly weeping in the corner. Clinicians refer to this as covert or vulnerable narcissism. While the grandiose, chest-beating presentation often skews male, psychologists frequently observe this intensely defensive, quiet variation in female patients. Instead of bragging about her wealth or achievements, the female covert narcissist demands attention through her perceived hardships. She assumes the role of the virtuous victim or the super sufferer. She weaponizes empathy. She might completely redecorate your house without permission while you're out of town, or overstay her welcome to help with your children. It looks like extreme generosity, but the hidden price tag is your total submission to her narrative. Offer even the mildest, most polite constructive criticism, and you will trigger a theatrical, highly disproportionate emotional collapse. Those tears project genuine fragility. In practice, they are a highly calibrated mechanism for dominating her immediate family and silencing any opposition. Living with this personality type leaves families perpetually exhausted and off balance. Every day involves navigating a minefield of guilt trips, emotional dumping, and subtle gaslighting, where her interpretation of reality is the only one permitted to exist. The people closest to her are often left asking the exact same question: how does a person develop this kind of relentless emotional armor? To understand the toxic reality of the adult woman, we have to investigate the hidden trauma of the child she once was. Narcissistic personality disorder requires a specific combination of genetic predisposition and early environmental pressures. Psychologists track these environmental triggers using a clinical metric called Adverse Childhood Experiences, or ACEs. One common pathway involves profound physical or emotional neglect. A child raised in a deeply unpredictable or abusive home internalizes a persistent message that she is entirely worthless. Another pathway operates in reverse. The child is heavily spoiled, overvalued, and treated as an extension of the parent's own egos, rather than recognized as a distinct human being with her own needs. These early relational failures deprive the developing mind of a crucial psychological milestone: the formation of a secure, cohesive sense of self. This diagram illustrates a defense mechanism known as splitting, which the child relies on to survive unbearable shame. The psyche isolates the devalued self, holding feelings of inferiority, burying it out of sight. To interact with the world, the child constructs an oversized, pathological, grandiose self. Societal expectations heavily influence the shape of this shield. Because women are often socialized to nurture and caretake, her grandiosity manifests as a fierce, unyielding need to be recognized as the ultimate giver. The adult woman operates without a genuine inner core. She relies entirely on external validation to keep that fragile outer shell from collapsing inward. Her manipulative adult behavior is a desperate attempt to regulate a terrified inner child by exploiting the emotions of everyone around her. Recognizing the trauma that caused this disorder helps explain the behavior. It does not excuse the abuse. You cannot fix her. Healing a personality disorder is a job for a clinical professional, not a spouse, a sibling, or a child. The only way to survive interactions with a covert narcissist is by establishing and enforcing rigid emotional boundaries. She will push back fiercely against these limits. Any boundary you set is a direct threat to the emotional control she relies on to keep her psyche intact. A boundary without a strict enforceable consequence, like calmly ending a phone call or walking out of the room, is nothing more than a suggestion. This flowchart illustrates a primary tactical defense recommended by therapists called the gray rock method. When she attempts an emotional dump or a guilt trip, you respond with brief, factual, and completely unemotional answers. By doing this consistently, you effectively starve her of the intense emotional reaction she desperately needs to feed her fragile self-image. True change for someone with narcissistic personality disorder requires years of intensive psychotherapy. Because the disorder itself prevents her from admitting fault, she is highly unlikely to seek that help. Your ultimate goal is to abandon the fantasy of the mother, sister, or daughter you wish you had.
You have to mourn that idea so you can successfully protect your sanity against the reality of who she actually is.